Hi, my name is Danielle Sapiens. I came in for the job interview.
Hi.
Hi, nice to meet you.
Nice to meet you. Take a seat.
How are you today?
Doing well. How are you?
I'm doing really good. I'm really excited to be here.
Awesome. So, why do you want to work here?
Well, I'm a local, and I plan on staying here for the rest of my life. I've already committed to that. And as a local, Natividad has always been there for me. They've been in almost every school event I've ever gone to. You know, they're really present in my community. And you guys also take care of 40% of uninsured Americans, and that just lines right with my values. You take care of my community, and I want to be a part of that. That's definitely close to my heart. I do have a bias, as you've seen from my application. I have family members that have lived here, so the retiring staff is really like my aunts and uncles, and I really want to pass that baton. So, yeah.
Great. What qualities do you bring to the table that would benefit our organization?
So I'm compassionate, empathetic, and caring, which is why I got into this profession. But I'm also hardworking, resilient. That's what got me through the nursing program. But really, I think that I have a really strong sense of integrity, and I don't break that for anybody. So when things like JCO come around, I'm not gonna be batting an eye because I'm gonna be doing what I needed to, the right thing, the right way. Anyway, I expect to be following the rules as they are written throughout my career, not just, some people like to say like, well, when Jacob's not here, this is what we do. But I really want to avoid that. It's not my style. I've worked for franchises before where they come in for the yearly inspections and they'll ding you on the smallest things. And I love to just, represent my tight ship. I keep a tight ship and I want to represent that. So, yeah.
Great. Good job. What are some personal strengths and weaknesses you possess?
My personal strength is I am that ultimate team player. I go into a new team and I look for that job that everybody hates to do, and that's my habit. That's my thing. So everybody knows that day when I'm working, that's taken care of, and so that's one less stressor off of everybody's mind. I did 4 years of ROTC, so I really know what it's like to be a really good follower and a really good leader. And I've been general manager almost every job that I've ever been in, so I know what it's like to be a leader. And I like to support my team members in the same way. I'm motivating. I am punctual. I'm just reliable. So I think those are definitely my strengths.
Mm-hmm.
And my weakness, I've been thinking about this a lot because this is that typical question. But especially being in nursing school, I feel like my weakness is really just me being hard on myself, and I can really dwell on something for a long time. And even though I'm so motivational and caring and accepting with everybody else, I hold myself to this really high standard that sometimes is just unattainable. And I've learned how to reel it back and just give myself a break sometimes, because at nursing school I really got good grades, but I was just so hard on myself all the time, and I would miss something and I would just dwell on it for weeks. So I really need to learn how to let things go sometimes.
Great. Okay, so where do you see yourself in 5 or 10 years?
5 or 10 years. Well, in 5 years, I see myself as be a stronger nurse and really settling in my skills as a profession and being able to pass that on to the younger nurses coming in and mastering that for, being a new nurse. And then in 10 years, I hope to be here, and like I said, if I'm here, I'm a lifer, and I noticed that you guys kind of need that because there's a lot of travelers in my out rotation. So solid staff might be nice. I'm right down the street, so I can always be on call. But in 10 years time, I'm in the middle of getting my bachelor's right now, and I never thought I would get this far. In high school, I was just not that, that grade A student. And, so I never really even dreamed to even get my bachelor's. So now that I'm here, it's really exciting to think that, oh my gosh, maybe I can take it that next step. So master's, you guys might be able to convince me if you guys want me to take a leadership position later. I would totally be willing to continue my education. And as the profession that I chose, I'm going to be continuing my education regardless. So who knows, I might as well, throw my hat in the ring and try it. I'm forever learning.
Good. And can you tell us a little bit about a time you had conflict with a coworker or employer, could even be your patient, maybe a family member, and how you resolved it?
I am the conflict resolutionist, and as I said, I was always given that general manager job in a lot of my positions because I don't have a problem with confronting people, and that was really hard. Everyone always wants to talk to a manager, and I always go back to the food industry because I did it for 15 plus years, but conflict is inevitable, and in the food industry, we like to use the word hangry, so people come to us because they're hungry, and if their food's not going to come out in time, they can get really angry, and it's gotten really out of control sometimes, but I'm always been that person, like, can you go talk to them, please? So I always just go straight to that person. So first of all, if I see that something's wrong with their order to begin with, I'm at their table within minutes. And I am explaining to them the situation, and I'm trying to give them a reasonable time frame in which we are going to fix this problem. So with conflict, you just cannot shy away from it. You have to approach it head on, and I'm not shy about that. As long as you keep it factual, you try to keep emotions out of it, then it usually goes pretty well. I apologize. I'm really good at that. And when somebody brings me a problem, I listen to them, and I listen to them fully. So. That's what mostly people want to be. They want to be listened to, and usually that's almost like they vent, and then they get that off of their chest, and then I clarify, what it is I heard. But again, I try to keep it factual and keep feelings out of it. And usually, I'm really good at conflict resolution. I'm not shy.
Great, thank you for sharing. Can you share with us one of your most memorable experiences with a client or a family member?
Or a family member. I can't really. I always think about this. This is like the most memorable moment to me when I did my out rotation at ER, and somebody came in a code asystole, and I had nurses on both sides of me. We were watching the monitor, and they were talking to me about what they would do if they were in the room, and what the positions were in the code, and how important it was to start compressions early as possible. And I left that day really honestly thinking, oh my gosh, can I do this? This is the first time I ever saw somebody die like that because the code was unsuccessful. And it really started making me doubt myself as a nurse. And I went to a Walmart the next day, and I was trying to get through the store really fast, trying to avoid people, and I came across this aisle where a man was on the floor and his young daughter was standing over him, and I heard my instructor in my head just tell me, you're the nurse, and I jumped into action. It was like I was in CPR class. I, ran to him, yelling, sir, did the sternum rub. I checked his pulse. I looked at his face, and his daughter yelled, "He's turning blue," and I turned into Transformer CPR right away. Locked my arms, was throwing my weight into it, and it was very stressful. People started to gather and crowd this really small aisle, and I could see his daughter trying to fumble, calling 911. And so right away, I started yelling out orders. Somebody else needs to call 911. We need to get as many people as possible. The signal's not very good here. Somebody needs to get the defibrillator. And then I realized not a lot of people know what that word is. So heart machine, I was trying to describe it while I'm, and maintaining compressions. Is it by the bathroom? And it was so crowded that I even started yelling out, like, can somebody go get some aspirin? We were right by the pharmacy. I really, this is my first code, so I'm just, drawing at straws here. But I did it. I did CPR until the EMT came. And right away, instinctively, as soon as I got off his chest, I was at the daughter's side and comforting her. And I was there for her when she called her family to the scene too. And then I just walked away. I remember that man's address too. But I know it's like I'm a nurse, and you know you have to, once you do your job, you kind of have to let go and stand by. So I think that was like my baptism of like realizing like this is I'm here. I am a nurse. I can do this. I will jump in action.
Great. What a great story. How do you manage your time and stressful situations?
Well, first I prepare. I try to prepare myself every day, so that way I am proactive instead of reactive. So I make sure that I am all the supplies that I need are ready. So as the better that you have your prep, I think the smoother the day you go. Same with the food industry. Like I go in there early. I prep in all my stations. I can kind of gauge in the food industry how busy it's going to be, and so I prep accordingly. But with the nursing, we don't know. You never know. Maybe it's a full moon, and so, things happen and it does get stressful. So I try to break down my problems into things that can be solved right away, and then things that, can be set and monitored throughout the day. And so then I always have in my mind, and I'm counting my steps and making sure that whenever, if I'm going to that room to check on that patient, I can stop by really quick and just say hi to this patient and just let them know, hey, I'm going to be back in half an hour. So I just kind of break it down into my problems into smaller problems. And I love a good checklist, and just to check off those things off the checklist just to make sure you don't miss anything. So.
Great. I know. I love checklists too. What questions do you have for us, if any?
Questions that I have for you is, I was just wondering, what is a typical day for a float position? Because that is what I'm most interested in. What units that you'd be interested in me floating into? I'm also interested in. Another good question. Questions for you. Is there anything like on my resume or perhaps during my interview that maybe is concerning to you, and that maybe just in case this interview just didn't go as great as it's going in my head, what is it that I can improve on, and what can I bring back? Because I am determined to come here. So I if you don't have a position for me today, I'll be here tomorrow. I applied when I was a phlebotomist, and I came back with my nursing degree. If I have to go get my doctorate, if that's what you guys need, maybe I have to go look into that. But yeah, if there's anything that I can improve on to be a better quality nurse for you guys, I would love to know.
Great. Well, thank you, Missy Beans. Oh, do I? You have no. That was 8.
There's one at the bottom about the.
The client. You have a client returning from surgery.
Sorry,
Okay.
they warned me about these questions ahead of time.
Yes. So, I hope you're ready for this one. You have a client returning from surgery. Status post-repair of a bowel obstruction. His BP is 90/50. Respiratory rate is 28. Heart rate is 113. Stats 97% on 21 NC.
Yes.
What would your priority be with this client? Explain to us the process of caring for this client immediately post-op.
Immediately post-op. So I spent a lot of time in PACU, and I know that we're doing we're doing vital sign checks every 15 minutes, every 5 minutes for the first 15 minutes, and then every 15 minutes from there. So I'm sure that I'd be catching this right away. Him being from a bowel obstruction surgery, I would, excuse me, being out of bowel obstruction surgery, I am concerned about maybe a possible GI bleed. So I would be, first of all, eyes on patient, assessing the level of consciousness, seeing, is there cerebral flow happening, how bad is the blood pressure affecting this person, and his heart rate being that high, that's definitely compensatory to that. So I'd be checking eyes on patients, checking the eyes on the incision area, in the surgery area, seeing if I can see any bleeding happening, whether it's internal or external. And I'd be notifying the doctor to come and help me assess this patient also, because we might be having to prepare for fluid resuscitation after he stops the bleed.
All right. And is there anything you'd like to...
There was one more at the very, very bottom.
Let's double check if I can move this.
Oh, I think that might have computer freezes sometimes, isn't it? I believe the question was about my understanding of sepsis. So sepsis, what I know about sepsis is that it is a systemic infection that happens, and which when the pathogen invades your blood vessels, your WBCs are notified, and a cytokine storm pretty much starts. And this causes vasodilation, capillary leakage, and so what we would need to do is we would need to get a CBC on this patient, and we need to figure out the cause of the infection, because first we'd probably start them on broad antibiotics, and then go narrow it down into what depending on what the infection would be, and then because of the cytokine storm that kind of made rips holes essentially through the epithelium and damages the epithelium, there's also these microemboli that happen also. So your platelets are being used up, and all your clotting factors are being used up at the same time, and so we need to catch this really early. But in the back of my head, I always have surge criteria, which is like knowing your patient's WCs. Do they have high bands, which is new WBCs trying to take over? Do they have a high or low temperature? Do they have a high or low heart rate? And keep pausing. I think I'm just gonna add that. So what happens is that there is sorry. There's a maldistribution of blood. I'm so sorry. Yeah, there's a maldistribution of blood. So what's happening is the pretty much your cells are not getting oxygen, and if they're not getting oxygen, they're not metabolizing, and eventually that can lead to cell death. So we need to catch this as early as possible, and start implementing our interventions ASAP.
Great. Thank you, Miss Sapins. You have a great day.
Thank you so much for the opportunity. You too.
Bye.